Globally, nurses are the most prominent pillars that uphold healthcare industries. They have historically been a huge symbol of any healthcare system. Some experienced nurses have been highlighting some of their most memorable moments in their careers. My most memorable moment is the first day I started my job, where I delivered a baby by myself. Whenever I think of that, it makes me really happy. Another thing I think about that makes me really happy is when I see healthy and healed children walk out of the hospital. One of the moments I remember is back in 1994 after the genocide against the Tutsi had just ended. We never thought of working for the money in this job. Looking back, it makes me really happy, thinking that it's not just the money that made me start this line of work. Yes, I did think of the money I would make later on, but never at that moment. I constantly tell this generation to love what they do. Some patients express with much gratitude the work nurses do in hospitals, describing how they are the frontliners of any hospital.
I brought my child to the hospital severely ill. I never thought he would recover, but when I got here, the nurses did all they could to comfort us.
They constantly check up on patients all the time. When I first arrived here, they attended to me really well. I'm very happy with the services they give. The president of the Rwandan Nurses and Midwives Union highlights some of the achievements in the nursing workforce, citing that it has been a long journey from where they came from.
After genocide, immediately after genocide, we were accounting about less than only 400 nurses in the country. Today, we have more than 11,500 nurses and midwives across the country, which is a very big achievement in just a few years. But about challenges, we are still counting a shortage of nurses and midwives. Considering the general population that we have in the country, which is estimated at 13 million, and with less than 12,000 nurses in the country, the ratio is very, very low. I think what is important for the Ministry of Health and other stakeholders is to have a good plan for human resource, mostly for nurses and midwives. I think you have to target a good number in the future that we need on the ground. So we have to invest in education, but also we have to work on the retention. Because if we are investing in education and we are not working on the retention systems, that would be a very big problem.
Given the current shortage of nurses in the country, challenging the healthcare system, Dr. Patrick Ndimubanzi, the HRH Executive Secretary in the Ministry of Health, says that students are being encouraged to enroll in nursing classes from high school to help boost the reduction of the current shortage of the healthcare workforce.
We're planning to develop a program of associate nurse who will start their training right from secondary, the fourth year of secondary school up to the sixth. And we think that will allow nurses to choose their career early on and to start practicing and going to the hospital as early as possible. There's a great opportunity because nurses will get to have more exposure in hospital. The other thing that's critically important is that it will allow us to be able to staff the different levels of the health pyramid, right from the health posts, health centers, district hospital, and referral hospitals.
Statistics from the ministry show that after the genocide against the Tutsi, there were only 390 nurses in the entire country, and now there are more than 10,000. This year's theme for the International Day of Nurses and Midwives is Nurses, a Voice to Lead, a Vision for Future Healthcare. This day was first celebrated in 1974 in the memory of the birth of Florence Nightingale in 1820. Gabi Muvunyi for RTV.